Hey guys, I'm Vivek Gaur, your cool physical therapist, and in today's video we are going to discuss another case of mine that was presented in the neurology ward. A 23-year-old boy started feeling tingling in his toes and feet, and in just 2 days later he started having those symptoms in his hands as well. Now initially he was having trouble wearing his slippers, and then he started having trouble standing up and walking, and just in few days time both his legs were almost paralyzed. He was not able to get up. His hands also starting getting paralyzed. He was having tingling all over his legs and hands and arms, and that's almost the time when he presented to the emergency ward in the hospital. From the ward, once he was seen to be stable enough, then he was shifted to the neurology ward, where a neurophysician attended him. It's almost been a week when he was having difficulty getting up from the bed. By this time his family was actually feeding him and dressing him up, and of course they brought him to the hospital. This patient was actually having complete paralysis both in his legs and up in his arms, and just in a week's time he was actually completely bedridden. It was too much confusing as well as concerning for the family. This patient had no history of neurological disorders. He was cognitively fine and oriented to time and place. At the time of admission, his blood pressure and respiratory rate was slightly higher, but other parameters were absolutely normal. On sensory motor examination, he seems to have feeling of touch and pinprick. However, there was a total loss of muscle control in his lower limbs and upper limbs, and there was areflexia as well. His plantar response was downgoing, so that was an important point to notice. From neurological point of view, this is an aggressive paralysis of ascending nature, and in this case study we will discuss the differential diagnosis of ascending paralysis. We will also contrast this case with other kind of neuromuscular disorders where paralysis is the presenting feature. The 4-part of this case study will be available on my channel on YouTube under student membership plan. If you haven't yet joined, please consider joining the student membership, and I will see you there. We will discuss in detail about the differential diagnosis of this case, and of course later on we'll move on to discuss the medical management and physiotherapy management, of course the long-term prognosis as well as the rehabilitation of such cases. So I'll see you there on the YouTube membership, and meanwhile you take care, keep moving, keep fit, stay healthy and stay sharp. Bye bye.